I'm joined now by Dr. Nancy Reau, who is the editor-in-chief of Clinical Liver Disease. Congratulations, this is a relatively new selection for you.
Yes, thank you so much, very new.
So tell me about the transition process.
Well, it's so hard. This is, first of all, a relatively new online journal anyway, and Mike Lucy was the pioneer and took it from its idea to a very successful and regularly released, well-performing online journal. And it's hard to follow in someone's footsteps that have seen that. But Michael is such an easy person to work with and so motivated to make sure that educational efforts continue that I know that we're going to spend the next year lining up so that I can take his mission and continue it. And he'll continue to be very involved even though he's going to hand the reins over to me. So I know he'll be available for questions and very motivated to see this successful.
And that's a great thought, that you're going to carry that torch but continue to have that kind of influence so that the goal of the journal remains true.
Absolutely.
And you've been involved even before you became editor-in-chief, I know, and discuss hepatitis C virus, because I know that's been a great focus.
Yeah, so I started my involvement with this journal as the guest editor for hepatitis C. And so this journal is such an amazing short nugget of high impact information, kind of written not just for simple clinicians but for everybody. I mean, regardless of your knowledge base, you're going to get something out of each one of these. And even when I'm reviewing them, I am still learning. And I often think, well, this is a topic I know well. What else are they going to tell me that's new? And you still build on that. So with hepatitis C, we tried to make sure that the journal featured all the new drug developments, the guideline changes, and hepatitis C has been such an evolving area. We have amazing curative therapies, and although there are other topics that are eclipsing hepatitis C in excitement, we still know that the pipeline for drug development is very rich. We expect to see more agents, more complex therapies that are able to eradicate the virus in these much more challenging patient populations, or shorten the duration, which should increase access, both by increasing the provider pool as well as offering a shorter therapy for individuals that are a little harder to retain in care. And we're hoping to feature these things in the journal.
I'm sure it's so refreshing for people to hear that you learn something when you read it, because then they know that they will as well. So talk to me about some of the other topics that are big in addition to HCV.
Well, so in the journal, I really enjoy a lot of the practical topics because there are generally reviews on things that you've kind of been struggling with but didn't realize you were struggling. Like, oh, what does this mean? And then lo and behold, someone has actually written a nice synopsis of what we know about it, what is still left to be learned, and that that not only helps you with your practical management, but also gets your brain churning. Like, maybe I should study this. Maybe we should pool these patients. Maybe we can learn more about what to do. And everything from the common everyday, like what portal vein thrombosis, do we anticoagulate these? Do we not? How do you evaluate a person with cirrhosis for surgery? And so they have these great topics that you are faced with every single day, and they're short. It's amazing how much incredibly rich information they can put into literally 2,000 words. So you can read it from start to finish, feel like you really learned a lot, and if you need to understand more, the references are there. You can take the next step and pull one of those and find out at another level what you might be missing.
Because clinical liver disease is so new, I'm sure there are a lot of people who have never even read it at this point. Who's the target audience?
Well, I think that also is evolving. In the beginning, we looked at it as a clinical tool, and I think we often would encourage our fellows or residents or maybe someone who didn't have as much of a knowledge base to use this as a great way to line up with hepatology. But when I read it, I'm like, that was a really good article. I really learned something. And I think that the more of us that have been forced to edit these, because they are peer reviewed, they're generally invited, but then they're peer reviewed. And all of the peer review, it's a pleasurable experience. I mean, they're short, maybe that's why. But you always learn something, and I think that when we review these, we then sell them to our colleagues. The reader base, though, is an evolving topic. We know we want to branch this out more. It gets a lot of outside of the United States hits. It's often translated into Spanish. And so that there are ways that we're finding that it's not just the AASLD in the United States that's using this journal, but actually a lot of people that you wouldn't have identified as our main reader group. So keeping in mind who's looking at your journal and making sure you cover what they need, but also grow the group that we know would benefit a lot, but just doesn't have the awareness that it exists.
Well, congratulations on your early success and
Well,
continued
thank you.
success. Knowledge is power, especially for
Knowledge
patients.
is power.
Thank you.